This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So my name is Drew Woods. I'm a PGY 3 at the University of Louisville. We also have our chief resident, Dr. Dave Levin, on the call, and our program director, Dr. Kalin. So they'll give some comments at the end as well. So University of Louisville, we are a now 4-year categorical program. So that's going to be new. You all will be our first class that will be part of the categorical and completing your intern year in Louisville, which we are very, very excited about. We also take full residence a year. In the last 12 years, we used to have 2 residents per year, so these numbers look a little bit off, but we've had 23 of our last 33 graduates decide to go on to specialty fellowships, ranging from sports medicine, peds, interventional spine, spinal cord, pain. We also had Dr. Shannon Strader last year go to Mayo for cell therapy as the first PM&R resident to do so. So really diverse structure that allows our residents to either go into private practice right away, or to go ahead or join academic medicine, or to go into a fellowship. And of note, we have the sports medicine fellowship at Louisville. We also have a spinal cord injury fellowship through our department at Louisville, as well as a pain fellowship through the anesthesia department at Louisville. So if you're interested in any of those, we've had residents go through all 3 of those, and they love to take our residents. So that's a big perk of coming here. Our training stats are a little bit off. They're a little bit outdated. Our procedure numbers are actually a lot higher than this. And Dr. Levin, if you want to post your own numbers in here, David is applying to a pain fellowship and has blown all of these numbers out of the water. So it really depends on how motivated you are in regards to how many procedures you can get. But on average, our residents are going to achieve far and beyond what is required. We train at various locations in the city. So for you all, the Robley Rex VA will no longer be an option because we have a new VA hospital that's opening in 2026. Fraser Rehab, which is where the majority of your training will happen, as well as Fraser Brownsboro, which offers our community rotation. It's a joint venture project where you'll see kind of a different patient population than what you'll get downtown at Fraser. And so it gives you a different perspective. We also rotate at Norton Children's for our pediatric inpatient rotation, and then U of L in the bottom right. And it's actually undergoing a very extensive remodel and addition to it right now. They're building a brand new patient tower at the moment. So a lot of new building going on within our program that we're very excited about. As you can see, we come from all over. And this is not all encompassing. I think we're missing the last 3 classes on this, but lots of, throughout the US. And this does not entail our faculty, which come from as far as Columbia and as close as here in Louisville. So really just a really diverse resident and attending population. So as you can see, we're very rigorous. This slide is very busy, but I did so to show how much we're doing. So our grand rounds from last year, a lot of really renowned faculty from institutions that gave visiting grand rounds for us. We also obviously have the normal board prep, but also have lectures that are both resident-led, attending-led, and then discipline-led, which I found really unique to learn that we got lectured by neurosurgery, pharmacy, nursing, and therapies, just to understand how our colleagues, what they're learning and keeping us abreast of what the latest is going on in their world as well. And then detailing kind of our rotation structure. So the PGY 1 year is not finalized yet, so I couldn't give you all exactly what you would be doing. But for the most part, you're going to be doing, I think I saw 2 months of medicine and a month of ICU. You get some cardiology, some neurology. I think there's some pulmonology mixed in there as well. I did a TY year, and our prelim year at U of L was known to be very difficult. And after seeing our block schedule for what's anticipated for you all, it should not be one of those soul crushing PGY 1 years. I think it's really well rounded. You guys are going to get some incredible experiences. You're not going to be overworked at all, and you're going to come into your PGY 2 year extremely well prepared to hit the ground running in our system. And then, as you can see, every program is going to be relatively similar to each other in terms of what your experiences will be. But some of the things that I think differentiate us is kind of the balance. So even in your PGY 2 year, you're getting some community exposure, you're getting some orthopedics and some prosthetics and orthotics exposure, you're getting into clinic as well. So at the end of my PGY 2 year, I think I had like 65 EMGs, 30 Botox procedures. I think I had 8 or 9 joint injections under ultrasound. So I'm not one that seeks out procedures. So a lot of really great experiences. And then you just keep building on that in your PGY 3 year. We get 2 months of inpatient pediatrics, which is what I'm on now, which I think is a really unique rotation that a lot of places don't have access to on the inpatient side. And so you're able to take what you're doing on the adult side and translate it, and then obviously go back. And then in our PGY 4 years, we're getting 2 months of consults. You get to touch TBI and stroke and SCI again, just because a lot of us do go out straight into practice. And so if you don't see that again, you may be going out into practice having not seen, a spinal cord injury in 2.5 years. So just to kind of touch you up one last time before you take boards and go out on your own. So money and other perks. So personal cubicles, moonlighting, which you can do to help supplement your income. We also get mock oral boards. I'm part of the U of L early learning campus, meaning I'm getting my MBA right now as I'm in residency, and I'm paying a discounted rate to do so because I'm a U of L employee. So really great opportunities there that our leadership is very supportive of. We also get free physician parking in the physician's parking lot itself in the garage. We get access to AA, PM&R QBank, and the program pays for you to take the Kessler Board Review course. Our salary is also very competitive. So if you go to Bankrate, and this is what I recommend for everyone who's applying, whether it's to Louisville or elsewhere, is compare and contrast the salaries and what it'll get you in other cities. So for example, on a PGY 4 salary in Louisville, you would have to be making $160,000 to live the same way in New York City. Now, obviously, New York City is more expensive, but your money goes a lot farther in Louisville than it does in other places of the country. And then we also get $1,800 a year for an educational stipend to be used on books and conferences and really anything you can think of that relates to education. And that's the view. So you really can't beat that view. That's from my cubicle earlier this year. So I look up every day when I'm at my desk and get to look out the window and really enjoy it. We have a great leave policy as well. You don't have to take it all at once. You can take 1 day at a time. So you get 20 PTO days per academic year. In addition, you get 5 conference days, which you can use for AA, PM&R, AAP, any conference you're presenting at. And we also get a quarter day of wellness, a half day every quarter that you can just take for anything, whether you want to get an appointment scheduled or whether you just don't want to work that morning, you can take the your quarterly wellness half day. And then thankfully to Dr. Schuster, our previous PD, and our U of L house staff, we now have paid maternity and paternity leave through U of L. And so you can take 4 to 6 weeks of leave and have it paid for. We have a new call system as of last year, entirely resident created, which was my favorite part of this program. Everything is very resident driven with us. And so we created a new schedule to try and relieve some of the call burden. We take home call with remote admissions, meaning that, at 4:30 when your day is over, you go home and you take all your calls and you do any admissions from home. We also have progressive call responsibilities. So obviously your PGY 2s are going to take more. But they don't take call in July to really let you settle in and get your feet wet and get comfortable in Louisville first before you have to then go on to take a more call. And then we divide the holidays evenly with a fall and a winter.
I love you.
So it works out really well. We also get food is great. So we have access to a physician's lounge that has some breakfast and lunch. We also get catered meals with our town hall meetings, and then we have tons of options around the area. The food trucks are a lot of our favorites because they offer a great variety, but they also offer really good prices. And so as you can see the picture at the bottom here, they literally just line up across from our hospital, and you can go out there whenever you want. We also have access to an exercise facility right down the street, which is the University of Louisville. So it's very nice because it's really designed for college students. There's a YMCA if you want a little bit more of an adult atmosphere. And then again, the leave policy, which we detailed earlier. And so again, they just literally line up and down the street. It's incredible. This is my favorite time of the year because they're all out there. So our work schedule for, mental and emotional wellness, our work schedule is really, really nice. We rarely go over 50 hours in a week, and that's if you pretty much have a bad call week. So I feel like I work a lot and I work really diligently when I'm at work, but then I have a robust life outside of work, which is really nice. Tons of faculty support and a really big culture of peer support. We're always stepping up for each other. If someone, is out for whatever reason, we're covering whatever they need. We have some volunteer opportunities as well, which you can see there, as well as our monthly town hall with Dr. Kalen and the rest of our program leadership, where it's just an open door. What's bothering you? What can we fix? What can we do differently? What's going well? What are you involved in right now that we can celebrate as a group? So it's really great. And then, like I said, the resident-driven initiatives, our call schedule is a prime example of that. Cardinal Conversations, which we'll talk about here in a second. And then we also have an ultrasound curriculum that results in a certificate at the end of proficiency signed by Dr. Kubinek, who's our MSK physician at the VA. That was created by our other chief, Dr. Hank Tobiner. And so it's just a group of us getting together every Wednesday, and we just scan each other with the direction of Dr. Kubinek. To become proficient at ultrasound, so that we can, utilize that. And it's not required. So for myself, I'm not super interested in ultrasound, and so I don't go to that. But, Dr. Levin, Dr. Tobiner, Dr. Munir, Dr. Rollison, a lot of them are very into ultrasound because they want to do pain or they want to do sports. And so they are pursuing that at their own kind of leisure. So as I mentioned, Cardinal Conversations is going to be starting up again. We started it last year. It was an initiative that I created and just came to Dr. Kalen and said, hey, I want to do this. And he said, great, how can I support you? And so that was my first introduction to Louisville, which was probably the best way that any resident can get welcomed. So we're doing it again this year because it was so successful last year. And so we'll start that up on August 14th. I'm going to turn it over to Dr. Kalen, and then in the chat, I'll put the sign up link for Cardinal Conversations so that if you guys are interested in attending, you'll start getting the Zoom links out as we get closer to the start of it. So I'll turn it over to Dr. Kalen.
Thanks, Drew. That was awesome. Way to go, and way to stay on time. He knows I like to talk almost as much as he does, and so I want to give you all some time to ask questions. But I did want to, number one, be here to thank all of you guys for your interest in our program. There's a lot of people on the Zoom call, which is great. And I also want to be the first to make a big announcement, and you will be the first to hear this as we make it more public tomorrow. But we've been really keeping a very close eye on the match process over the last few years, in particular since COVID. And as you all know, that process has dramatically changed in that it went from a completely in-person process to a completely remote process. During that time frame, there have been some noticeable changes that have occurred. People have tended to stay closer to home. They have also tended to want to not move as much. And so just like Drew said, we like to listen to our residents. We also like to listen to our applicants and to see what's going on around the country. And in response to that, number one, we've made move this from an advanced program to a categorical program because we wanted to provide our residents with, number one, fewer moves, number two, an internship that would really set them up and prepare them for PM&R residency. So we have a nice mix of medicine, orthopedics, geriatrics, other kinds of opportunities that will make you not only give you a good foundation in medicine, but also prepare you for PM&R. And what we've also decided, based on what we're seeing, is that it's really important for people to come and see Louisville. And so if you've never been to Louisville before and you're from the East Coast, the West Coast, the Deep South, your impression of Kentucky might be that we're all hillbillies. We don't wear shoes, and the city doesn't have any buildings taller than 5 stories. But as you can see from Drew's picture earlier, we have a 15-story rehabilitation hospital that looks out over the skyline of Louisville. We're a metropolitan city of 1 million plus. There's a lot of great opportunity for activities, enjoyment, and things in the city, and the rehabilitation program. I would put it up against any. But we think you need to come see that. It's easy to think about the Shirley Ryans of the world and the Kesslers of the world and the NYUs, the Tiers, and most people have been to some of those big cities. So our announcement today that you'll be the first to hear is that we're going to make a decision to kind of buck the system, so to speak, and move back to face-to-face interviews. We understand there are negatives to that, and we are quite aware that that may not make it a possibility for everyone, but we think that it is offset by the ability to come and see the program and to really see what makes the University of Louisville and Fraser Rehab special. So we invite all of you to apply. We invite all of you, if you receive an invitation, to come and see the place. We think it will make a difference. Louisville, Kentucky is within a half-day drive of 60% of the population of the United States. So we think that it's a very accessible city, and we think coming to see us will make a difference in your decision making, so that you really know what you're getting into when you apply to the University of Louisville. So with that, I'll turn it back over to Drew and see if there's any questions.
Awesome. And Drew, you guys have 4 minutes remaining.
Thank you very much. Yeah, thanks, Dr. Kalen. I appreciate it. I was trying to keep up the chat. So if anybody has any questions, feel free to throw them in, or to unmute yourself if they're allowed, Tiffany. But I will say one of the things I forgot to add was that how family friendly our program is. So last year we had 3 residents that all went out on maternity or paternity leave. This upcoming year we have 4 residents that'll be going out on maternity and or paternity leave. And so we're just a really family friendly program. So if you have families, Patty, our program coordinator, wanted me to make sure I told you to please come to Louisville, because she wants as many kids in the program as possible. So I had a direct message asking about US IMGs. We've had multiple IMGs in the past. Our most recent graduate, Dr. Robbie Veriker, was an IMG. He was from New Brunswick, Canada. So yeah, definitely an IMG friendly program. Not to speak for Dr. Kalen, but I knew the answer to that one. Dr. Kalen, someone had asked if you have any policy or any sort of encouraging on signaling.
Yeah, I think signaling is going to be interesting because it's changed this year. But what we know is that people tend to signal their home institutions unless they're told not to, and then they signal the top 10 or 12 programs by reputation. And I really think you need to be very thoughtful about doing that. I think you should probably signal the programs that you really think you're most interested in, not the ones that you think you are hoping that you might have a shot at getting into. Not that you don't have a shot at getting in all of them, but I just think that, again, you really want to investigate your programs, learn about them, and then signal the programs that you think you best match with.
Thank you. And then David, someone had asked if you could explain the call schedule a little bit more, the 223 model.
Yeah. So basically the way the call schedule works is you take home call in a couple different blocks. So Monday and Tuesday night, you'd be on call from home, and then you'd be done with calling. A different resident would take over for Wednesday, Thursday, and then you'd be done with that kind of block, and then a different resident would take over for the weekend, and that would be Friday night up until Monday morning. The weekend just works for continuity. You do round, but then it's everything else is from home. So and on Saturday you have another resident who comes in and helps with the new patients. So it tends to move pretty quickly. And you can't beat home call. We've been able to decrease the call burden and make it work nicely for all the residents. And so that's kind of what the 223 model is, if you will.
Well, I will try and respond to stuff in the chat. I know that David and I will be around for a little bit longer. Dr. Kalen, I believe, will as well. You all have our emails. I'll put the link for Cardinal Conversations in as well. So feel free to sign up there, where we'll detail the program in even more depth than we had here in these 20 minutes tonight. But thank you to Virtual PM&R Scholars for the Virtual Residency Fair. We appreciate it.